Welcome to Dr. M Health Corner Health Show. Welcome. Happy spring. Today, it's a different day. I am your guest and your host. And hopefully one of my colleagues, a dear friend, Dr. Yvonne, might join us. Today, I just thought, why can't we look at the World Health Stats and basically look at what is common out there? Where are we in terms of our health status? So today, it's exciting. I'm going to actually share with you the stats of South Africa and Canada. I'm sharing South Africa because that's what I'm familiar to. And of course, I'm familiar with South African stats because I'm South African and Canadian here. So yes, I hope everyone is doing well. It is a Friday here, the 8th of April 2021. Today, our topic is disease prevention and screening. I see people are coming on here on Facebook. Thank you for joining in. Let me know where are you joining from. Let me know where you're joining from. I see people are joining here. Thank you so much. So basically today, our stats is basically 8 million people live with chronic diseases. And actually 8 million people have died. Let me rather put it that way, have died of chronic illnesses. And today I want us to look at what should we screen for, and of course, what are the diseases that are killing people worldwide. I was looking at the stats in Canada. I'm gonna share with you here my stats. Looking at Canada, this is a 2016 stats from the Canadian Cancer Society. Us here, we have the highest rate of cancer. That's basically the incidence and mortality pie graph here. It shows us we have 29.6% of mortality due to cancers, different types of cancer, and of course followed by the 19.2% heart diseases, which is, I think it's more specific in the United States. Their highest mortality cause is heart diseases like ischemic heart disease. And then of course the other stuff here in Canada. And I wanted to show you the South African stats right here. In South Africa, let me rather say in Africa as a whole, we're still struggling with TB. TB is leading and followed by diabetes. After diabetes, it's cerebrovascular disease, basically heart diseases. I want to talk about that actually. In South Africa, number 2 is basically diabetes. But here's the thing. Diabetes has complications, which are usually stroke and coronary artery diseases. So it does catch up somehow with the world stats because worldwide, mostly United States, is ischemic heart disease. And one thing I've realized is our lifespan is different a little bit. In Canada, average lifespan is 84 years for a female and 80 years. The latest is 80 years for a man, for males. And in South Africa, it's 64 years. So there's that 20 years difference. So what are they doing differently in Canada? Here's the thing. In Canada, or let me rather say, in the first world countries, we use an approach of preventive medicine. What it means is we screen, we look for these diseases. And that's why their lifespan are higher than most countries, developing countries and low-income countries. So what can we do to improve our lifespan in those other countries? That's what this topic or today's topic is about. So what I usually do is I bring up these stats or this rather table that we always talk about when we look at our patients, when they're coming in. When a person reaches 18 years, everyone, when you reach age 18, it's time to screen. You look for your blood pressure. Blood pressure needs to be measured every year from the age of 18. There's few exceptions where if you are younger, you have maybe a tumor in your kidneys or you have a tumor in your adrenal glands, you might have high blood pressure. Yes, even kids could have high blood pressure. But generally, our general population, we recommend people to start screening for hypertension from age 18. All right. So age 18, you start screening for hypertension. Every year, you check your blood pressure. And of course, your diet. People underestimate the diet, things we eat. Things we eat like salt. Salt could be on your foods or the chips or just, all the foods, the greasy foods we eat that are always high in salt could eventually lead to hypertension. We're starting to see young people as young as age 25 with hypertension. So yes, from age 18, start screening for hypertension. That's number one. Now, things have changed here in Canada. We've changed our scheduling a bit. We used to say by age 21, everyone should screen for cervical cancer. Yes, cervical cancer kills. And unfortunately, I remember when I used to practice in South Africa, we used to see cervical cancer in the later stages. Our the grandmakulus, the grandmothers would have late stage, like stage 4, which was palliative. Nothing could be done for that. So we always encourage people to screen for hypertension. For cervical cancer. So what do? You do your pap smear by age 25. I think it's a worldwide thing now. People are screening at age 25. That's when we start screening for cervical cancer. And of course, follow your guidelines, your country's guidelines. Some people, they screen early, they screen as early as 21, but I believe that this is a worldwide thing now. Everyone starts screening at age 25. While I still talk about cervical cancer, I would like us to talk about prevention. Cervical cancer is preventable. We basically recommend young boys and young girls in schools here in Canada. We started a few years ago giving it this vaccine. It's called, in the beginning, we had Cervarix, and then we also have this HPV one. The most commonest is Gardasil 9. So basically, it covers more strains. It would protect you from anal cancer, from throat cancers, and of course, cervical cancer and vaginal cancers. Because the reality is, there's men who sleep with men could have anal cancer, right? So we recommend it highly. In schools, it's given. And I understand in South Africa, it's only given to HIV patients. That's fair enough, because unfortunately, one of the complications of HIV is cervical cancer. So we do see that. So kudos to South Africa for doing that, right? So cervical cancer screening. And then when do you go back? If there's an abnormality, follow through with your doctor. You might be asked to come back in 6 months to come and redo your pap smear. Do it, because if you get lost in the system, you could come back late. And unfortunately, you could come back late in the later stages. We see people as early as in their 20s, in their late 20s or 30s, having cervical cancer. So when you are asked to come back, come and rescreen. And if you need to do something further, like colposcopy, where your gynecologist or basically the cancer clinic would remove the abnormal pap smear cells, that's what they would do to make sure that it doesn't progress to full-blown cancer. So it depends on your stage. So that's why it's important to follow up with your nurse or with your doctor. Go back and do your screening, right? And of course, while I'm talking about younger people, in men, when they're in their mid-20s to mid-30s, there's a high risk of testicular cancer. So I always teach my male patients how to examine their scrotum, because it's very important to examine your scrotum to feel for your testicles. Are they both there? Are they hidden? Because that would increase the risk of infertility. So always feel, do you still have both testes in your scrotum? If you're feeling one, or do you feel another lump, a third lump? Is it hard? Is it painful? Sometimes it's painless. Kindly see your physician right away. It's very important. And while I'm still talking about testicular cancer, I always encourage boys and just man, if you feel any pain in your testis area, kindly go see your doctor immediately, or rather go to your ER, your closest ER, because sometimes testes could twist. It's called torsion. You could have torsion of your testes, and this could cause death of your testes because that would compromise blood supply. So all the time, if you feel pain in your scrotum, go immediately. Don't be shy. Go immediately, because the ER doctor will do an ultrasound and rule out torsion of the testis. All right. Now, what more can we screen? Family history is something that I always make sure that I share with my patients. Know your family history. What did your aunt, your uncle, your mother, your father have? You know, family history like diabetes, family history like hypertension, family history like cancer. These are the things, or heart disease, or heart attacks. These are conditions that unfortunately would affect you, more especially if you also have other risks. Other risks would be your smoking, you drinking, like excessive drinking, smoking, because smoking obviously would cause chronic lung diseases. I'm going to pull up again the slides for us here and show you how these slides, like specifically the South African slide. As you can see here, though, it's more on the lower area, like the chronic lower respiratory diseases, like other than TB, that would include your pneumonias and, of course, your chronic obstructive lung disease. But here in Canada, it's also one of the causes, but 4.6%. It doesn't mean that it doesn't affect more people, but because all these things are interrelated. I have my lovely colleague here, Dr. Yvonne. Thank you, buddy. Welcome, Dr. Yvonne.
Hi, how are you?
I'm good. How are you?
I'm good, thank you.
You look amazing.
You too. You look amazing.
Thank you. I was still sharing about what things people need to screen for. I'm going to introduce Dr. Yvonne. Dr. Yvonne Concord is a wonderful colleague. She's a family physician, an obesity medicine specialist, an associate professor at one of our universities here in Calgary, in Canada, and one of the medical directors with one of our amazing support systems like PCN, Primary Care Network. I just love what you do there, Yvonne, because it's part of our Alberta Health Services. They just about what I'm talking about to you guys, the disease prevention. What they do, they encourage us physicians to connect, or them actually, they connect patients who do not have doctors. They connect them to us, people that are looking for doctors, so that each person has a doctor. Like I said in the beginning, we are about prevention. Preventive medicine. That's what we're about. Dr. Yvonne, I was sharing about the stats of Canada compared to South Africa. I'm pretty sure you would have your Cameroonian stats, but in South Africa, the lifespan there is 64 years. In Canada is 84. So we need to bridge this gap, this 20 years. What can we do differently? Welcome, by the way.
Thank you. Thank you. I think it's just more education in the developing countries, right? There are times where people feel like, even here in Canada, you've seen in the immigrant population whereby they're like, oh, if I don't know, it's better, right? So a lot of education has to be done where we go like to the masses and say, listen, prevention is better than cure. Let's work together. Let's, encourage them. I know also back in the developing countries, there's also the financial aspect of it, right? Whereas in Canada, most people, as long as you have your healthcare insurance, you can go to the clinic. But we still have those challenges in our immigrant population, sadly. So there's a lot that has to be done, and it starts with each and every one of us, like talking to our families, talking to back home, Yeah.
Yes. Thank you so much for sharing that, Doc, because I do see, I have, you would agree with me. We don't have many immigrant patients.
No, no.
People still need that education, like you are saying. People still feel you pay for your healthcare. Like back home,
Mhm.
the mentality is you go to a doctor when you are sick, right? But
Yes,
yeah,
exactly.
in this side of the world, it's okay.
Hmm.
Just come
Hmm.
in. I was
Hmm.
sharing here that as early as 18, we need to start screening for blood pressure. Is it
Hmm.
high? We need to,
Hmm.
talk to our children also not to eat too much of those salty chips.
Exactly. Yeah.
So
Hmm.
Yvonne, tell me, what do you see in your practice in terms of the prevalence or the incidence of high blood pressure, cancers? Is it more prevalent in the immigrant, population,
Hmm.
or generally? What are you seeing? I just shared here earlier on the
Yeah.
stats we
Hmm.
have that in Canada we have higher cancer compared to the states. They have higher their incidence than the cause of
Hmm.
mortality is ischemic heart disease.
Yeah,
What do
no,
we
I
see?
would say generally it's the same, but I find that at least in the non-immigrant population, they are okay screening and they are okay taking the medications. In our populations, it's always, oh, am I going to take it forever?
Wow.
And the answer is usually it doesn't mean that if you start taking the medications that you take it forever, right? There might be if you get into lifestyle changes. I've had patients who stop taking their high blood pressure medications or their
Right,
diabetes medication because they've had that lifestyle changes in place.
right,
But it takes a lot to get there, So I
right.
would say in my practice it's kind of 50-50. But those who come with like really, really super high blood pressure are mostly the immigrant population because they don't just want to come to the clinic. They just don't want to come for checkups. And then they come and you tell them and they tell you, oh, I worked last night, or oh, I was fighting with this person. And then you say, okay, go home, measure it, come, and then they tell you, oh, it's just been stressful, right? There's always that something. Yes, we know that stress will really increase the hormones and all that, and it will cause people to their blood pressure to be high, but not when it's that consistent. At least when you sleep and you get up, it should be low, but not that they get up and blood pressure is high.
Of course.
So, oh boy, we just have to keep fighting and
Yes,
encouraging them to come for their checkup. Yeah.
of course, of course, yes.
Hmm.
Yeah, no, I love that. We need to do all these outreach programs because, like I
Hmm.
said, it's the mindset. We both know that
Yes.
mindset is key, for as
Hmm.
long as people don't know about the bigger picture and the complications. Because, like you
Hmm.
said, some people are like, is it going to be long term? You know, and now with all the lifestyle modification we're doing, you want to share about the hope
Hmm.
we have about diabetes and managing it with diet and also just
Hmm.
lifestyle modification in your practice, obesity
Hmm.
medicine practice.
Hmm.
What are you seeing, like the changes? I know you always share these exciting things about your practice.
Oh, it's so exciting when you have a patient or a client who is on like one or two medications on, let's say, diabetes or high blood pressure, and suddenly they go down to one. So
Yeah.
it's success. Or somebody who is diabetes, just the beginning of it. So, like in Canada, we define diabetes with an A1C of 6.5 or high fasting blood sugar of. So suddenly you see this person, you tell them, okay, I always would ask them, what are your goals? And most of the time they will tell me, I don't want to take these medications anymore. And I say, well, if you don't want to take these medications anymore, then we have to work together. But you are at the driver's seat. I'm just there to guide you. Because at the end of the day, I can say all what literature says, I can say all what science would say, but when you live from here, you're the one who decides whether you want to do it or not. And so you have to be ready. You have to be committed. You have to know your why. Once you have your why, then you can set realistic goals. And so most of the time, like, okay, yeah, I just, and then I say, okay, let's calculate how much is it, for example, per month for your medication. And then they sit and they say, oh, I could save that. I could save that. And so I'm like, okay, let's start. Let's start working on our diet. What is one thing that you can reduce this week and
Yes.
next week? So we write it down. And
Right.
it's so funny how sometimes it's as simple like in Canada with the Tim Hortons. They have the double coffee. And
Yes.
suddenly I said, let's make it single for the next 3 days. and then we make
Right.
it to single. But it's
Right.
change. It takes time to
I
build a
love it,
habit,
because
you know,
you are practical, and it's small steps.
baby
I think
steps.
medicine is evolving too. We want, like you said, you want to work with your clients. What is
Yes,
the best approach? What is practical for you? What can you
yes,
do? Right? And
yes.
it's sustainable. It's sustainable.
Exactly, exactly.
Women,
Because the goal is, hmm
yeah. Yeah.
hmm
Like in practice, I've talked about smoking cessation, and people are
hmm
like, yeah, I go, do you like traveling? And then a person says, yeah. I'm like, do you really, would you imagine yourself long term? Would you like to carry that oxygen tank? It brings another awakening. I
exactly.
don't want that. I love water. I want to go in there, right?
Yes, yes,
Or some of them, they want to play with their grandkids. They can't.
exactly.
Sort of
Yes.
brat.
It's so important. What is your why? Like
But
whatever we're doing in our daily lives, right? So we take that along and say, what is your why? What would you benefit from this? And they say, oh, wow, I never thought about it that way. And then
yes,
suddenly they leave from a double double to a single single. And before you know it, the sugar starts going down.
yes,
And then I said, then you start reminding them, I tell them to do a food journal, you know, they bring it to me and we look at it and said, okay, I always use my fist to say this, think of your rice, your carbohydrates like this, right? Think
yes,
of it, you reducing it, just
yes,
think of reducing it a little bit and go half. They say, oh, and then fill up the rest of the plate with vegetables. I said, not only is it good for your digestion, it's good for your blood sugar. They said, oh, digestion, that's a big one.
yes,
So just those
yes,
little things, there's like, oh, that's a
little
reason, doc. I
things,
have
yes,
problems with constipation sometimes. Now suddenly they start going to half of this and the sugar starts getting better. And then we
yes.
go, okay, what about
And
next
then
week?
that abdominal fat goes down, because that's another
Exactly,
problem we have,
exactly.
right?
And then the next week we say, okay, what next goal? Let's think of physical activities. Oh, doc,
Yeah.
my back. You know what they always say? Oh, my job, I'm always walking around every time. But then I said, think of it. When you're walking around, yes, it can be physical activity, but you're walking. Think of something that you do for you, whereby
For
you
you.
create that 20 time, 20
Yes.
20 minutes and say, I want to do this for me.
For
And they
me.
go, oh, but that makes a difference. I said, let's start with 10 minutes a day. Go for a walk, 10 minutes a day.
Yes.
Then,
Go with your
it
kids, go with your
yeah,
spouse, take your dog
yes,
along,
take it,
right?
right?
Love
10
it.
minutes a day. Then next week, let's make it 20 minutes. And then it slowly becomes a habit,
Yes. And then
So,
enjoy it, because you feel good when you
yes,
exercise.
exactly,
People need to
exactly.
understand this part.
Yeah.
Exercise is not about running. It's
hmm
about the things you enjoy. The walking you talked about, the
Yes,
swimming, right?
yes,
The
yes,
jog. It's just
yes.
beautiful. Now it's
hmm
spring here. It's
hmm
lovely. It's so
hmm
beautiful. So,
hmm
Dr. Yvonne, we also talked about, I didn't want to miss this for men, for young men,
hmm
the
hmm
screening of testicular cancer.
Yes.
It breaks my heart when we hear of
hmm
young kids, you
Yes.
know, with testicular
hmm
cancer, like in their mid-20s, or even a
hmm
child. We talked about also the pain, the torsion of testes, that parents need to teach their kids how to examine their testicles, right? Because any pain could be an emergency. And now let's share about, what do men and women age 40 need to screen for? I'm pretty sure people are excited to know about, what do I need to screen? I'm 40 this year. What should I do, Yvonne?
Yeah. So you have to start thinking about diabetes, right? For sure. Blood pressure, you've already talked about it. And if you're 40 and you've never had your blood pressure checked, then there's a big problem. you know,
Yes. Yes.
Yeah, and then for women, you have to think about mammogram. Some guidelines will say you can wait and start at 50, but I say to myself, if you have access, why not?
Why
Why not?
not?
I'm
Yes.
not gonna.
Okay.
I've
Change
in
to,
this
yes.
pandemic, I've seen so many people in their 40s, some even in their 30s, with breast cancer. Specifically, they have the family history. You
Right.
know,
Yes. We
yeah,
shared about
and
family history here.
yeah. And also, Dr. Nachi, the one thing I've started doing too at 40 is colon cancer screening. I am not waiting. The
You know
guidelines will tell
what,
you
Yvonne? I
50 to,
actually, you are
yeah,
so right. I remember even
yeah.
here in Canada, we
Mhm.
talked about we're gonna start screening people from as early as 1980. like people born in 1980. So that's 40 last year.
Yeah.
Wow, that's awesome. You start doing the fit test, right?
Oh yes, I've started doing the fit test. Initially, I thought maybe the lab was gonna
The fit
say
years and
refuse because the form says 50 to 74, but I send and they do it. Especially in our
they used
population
to
because yes,
decline that. So that's
yes.
wonderful. I'll
Mm-hmm.
start with that. I mean, I've been
Yeah.
doing it early for people with family history, and of
Family
course,
history. Exactly.
colonoscopies. Yes,
Mm-hmm.
wonderful.
Mm-hmm.
Yes, wonderful.
Mm-hmm.
And then, of course, for men who are 50 and
Mm-hmm.
above, we need to
Oh
screen
yes.
for prostate cancer. I was
Yes.
surprised
Yes.
when I looked
Yes.
at the stats here in Canada alone. They said the hypothesis is men, even
Mm-hmm.
5 million men, would be diagnosed with prostate cancer because men are scared to come for that exam,
Yes.
Yvonne.
Yes.
They're
Yes.
so scared. Even when I
Mm-hmm.
tell them, listen, it's gonna be so few minutes, I mean few
Mm-hmm.
seconds, I'll just
Mm-hmm.
examine because guys watching us, prostate cancer is very important for men here. It's very
Mm-hmm.
important. It's one of your sex organs, basically.
Yeah.
When you
Yeah.
have prostate cancer, and now it's late stages where maybe you might have to remove it, that could affect your sexual life. So
Yes.
screening is better than cure because
Exactly.
prostate
Yeah.
cancer, it does change people how they feel about themselves, their self-esteem, and of
Mm-hmm.
course the erectile
Mm-hmm.
dysfunction that comes
Yeah.
with it, right?
Think of retrograde ejaculation, right? So
Yeah,
it's not fun, right? It's
yes,
not fun at all. Or the urinary symptoms that come with that from
I know.
the prostate pressing on the urethra. So yeah, that's
Yes, our men
mhm.
watching here, please go screening and know
Yes.
your family history. Know your family history of your uncle, your dad,
Mm-hmm.
your grandfather. In South Africa, actually, our president Nelson Mandela had prostate cancer, and he actually
Oh.
survived. He didn't die from it. He
Mm-hmm.
was lucky enough. It was screened early,
Mm-hmm.
and basically taken care of. And also Archbishop Tutu. So
Mm-hmm.
it's what I always say to my patients: if you were to have cancer, probably
Mm-hmm.
have prostate cancer, because if it's found early, unfortunately,
Yeah.
when it has gone far,
Mm-hmm.
boom, your back, it goes to your bones. So people
Right?
need to know.
Exactly. Yeah, no,
Maybe.
prostate cancer is something that's close to my heart. My dad has had it for like 15 years now, you
I
know.
know.
So if it gets detected early, yes, at some point, some people, they always say prostate cancer is one of those conditions that you die with it most of the time.
Yes,
My
people don't
preceptor
know
always say you die with it. You don't die from it because
from it.
depends because if you're doing your screening regularly, right? It gives you it's one of those cancers that gives you a long rope to pull. It doesn't just come overnight, except if it's discovered at the late stage, and it's really really hard for someone to have prostate cancer and not have any symptoms, which the most
That's
common
true.
will be like urinary symptom or maybe the hematuria, which is blood in the urine at
Right,
certain stage. So,
right.
but it's just that sometimes people might have that and just say, oh well, tomorrow,
I know.
tomorrow, right?
I think
It's
it comes
yeah.
with a lot of shame. Men are scared to
Yes.
come in, and
Mm-hmm.
but interestingly, I'm starting to have more male patients. They
Mm-hmm.
because they
Mm-hmm.
feel comfortable. I don't know why,
Yeah.
but
Yeah.
it's good that it's important that they need to be screened. Sometimes I
Yes.
find some female doctors are scared to ask for that digital rectal exam. We
Mm-hmm.
can't
Mm-hmm.
forget that.
Mm-hmm.
One of my
Mm-hmm.
profs in our residency times used to say an exam without a direct digital rectal exam is incomplete. When you
Mm-hmm.
have not
Mm-hmm.
checked that prostate, your exam is
Mm-hmm.
incomplete. So
Mm-hmm.
for our
Mm-hmm.
viewers here, if you go for a physical exam and your doctor did not do that, ask for it. Ask for it. It takes few seconds, because this is how we diagnose also rectal cancer. Yvonne, I remember a few years
Mm-hmm.
back, 10 years ago in Regina, I had a very healthy 50-year-old farmer. I'll never forget that. 50-year-old man, very healthy. It was his wife who was persisting, go for exam, go for exam. He said, I'm busy. I'm a farmer. All right.
Mm-hmm.
And eventually he came in. I did his labs. Everything was fine because he's a healthy man. He's not on
Mm-hmm.
medication
Mm-hmm.
and no family history of anything. And I think the only risk for him was probably the chemicals, the farming chemicals.
Yeah. Yeah.
So I did exam. Things were going well, and then I put my finger in there. I was faced with a lump. Indeed, he had early stage 1 rectal cancer. So rectal examination is incomplete. That's basically why I don't forget doing that exam, because I could have, it's easy to forget. Easy to forget. And men usually are okay with you. She didn't use, or he didn't use my finger around down there. They forget about it and they don't want to do it. Right?
Yeah.
Yes.
Yeah.
Yes. And then also women, the older women, uterine cancer. Let's talk about
Oh, yes. Oh, yes. Any
that.
post-menopausal bleeding, if you're already in menopause and suddenly you start spotting, that's a red flag. You need to run
Yes.
like yesterday to your doctor, you know.
Yes.
And,
Yes.
we here in Canada, we do the screening from 25 years, we go to like 69 or so. Depends if you've never had an abnormal test, it's once every 3 years. But if you've had a normal test, then it's every year. And I remind my patients it's every year. And they say, oh, 2 years ago it was normal. And I go, no, it was normal, but we still have to do it
Because it
every
could change.
year. Yeah. And then if you've had a hysterectomy as a result of cancer, cervical cancer, or uterine cancer, we still would do swabs for the vagina because
Guess
you
what,
never
Yvonne?
know.
Now that
Yeah.
mentioning that, I had
Mm-hmm.
2 clients that had vaginal cancer,
Mm-hmm.
and they were like, no, I had my uterus out. I'm like, for
Mm-hmm.
as long as you are sexually active,
Yeah.
you could have that HPV.
Mm-hmm.
Cervical cancer or vaginal cancer is mostly due to HPV, which is human
Mm-hmm.
papilloma virus, which is an
Mm-hmm.
STD. It's an
Mm-hmm.
STI. So I said you could have. And indeed, some people, they do get
Mm-hmm.
vaginal. Thank you for doing that, because sometimes I
Yeah.
find there's the mixture of protocols. People are like, I've had my
Yes.
hysterectomy. I'm like, if
Mm-hmm.
your hysterectomy was due to
Mm-hmm.
cancer, you even need to come
Yeah.
back here all the time.
Exactly. Exactly.
Yes.
And the other thing is, if I don't have documentation, then in my brain is cancer until proven otherwise. If you show me your documentation that it was for fibroids, then okay, at least I have something that I can say, okay,
Mhm.
that's what it was.
Yes.
And then when you're like 65 and above, we start thinking also about like bone mineral density for osteoporosis,
Yes.
because
Yes.
we need to screen that. If not, people end up getting fractures and or so
Yes.
ladies,
Yes.
we all need to top up on our calcium, and even men, calcium and vitamin D. We
Vitamin
need
D.
to top up on that. Calcium, they recommend at least 1,200 milligram from all sources, and vitamin D, 1,000 should be okay,
Yes.
especially
I
for
pump it up, Yvonne. I
yeah.
pump it up, for 50 and above, I go
Mm-hmm.
2,000,
Yeah,
3,000
yeah,
vitamin D,
exactly.
right?
Yeah,
Yes,
yeah.
because it's
They
too
can go
cold.
up.
We
Yeah.
don't have enough, sunshine in
Mm-hmm.
Canada.
Yeah, we
Wonderful.
don't. We don't.
Yes. I want to actually amplify what you said for post-menopause women. Post-menopausal women watching us here, if you have
Mm-hmm.
any bleed, menopause means no blood after you have had no blood for 12 months. That's
Mm-hmm.
menopause. That's the definition of menopause. No menstruation for 12 months. But if you
Mm-hmm.
suddenly develop that, you see blood, spotting, or whatever,
Yeah.
please go see your doctor. I liked it what Dr. Yvonne said, like yesterday. Go
Oh
see your
yeah.
doctor. Sometimes it could be due to atrophic vaginitis, because it
That
can be
too,
right out there
exactly.
when
Mm-hmm.
menopause, but you
Mm-hmm.
don't know. You
We
need
don't
me,
know.
Dr. Yvonne, to look down there.
Mm-hmm.
And for precaution, we always want to send you for at least you need biopsy inside the uterus.
Exactly. Endometrial
It's
biopsy, very important. Yes.
love
If we
it.
do it and then it's negative, then we are happy. And right, you're happy too.
Right,
Mm-hmm.
right. And let's talk about prevention of course, we talked about the stool test for colon cancer. And if there's a family history of colon cancer, then the screening is different. We do colonoscopy. You have to
Mm-hmm.
go. There's actually an amazing colleague who talks about this. I love what he does on LinkedIn. He talks
Mm-hmm.
about it. I'm hoping people who follow him on LinkedIn
Mm-hmm.
go for this screening, because that's
Yes.
what he talks about every day. He talks
Yes.
about, he's a gastroenterologist. I just forgot his name. Dr. Brian.
Brad, I think.
Dr.
Yes.
Brian.
Mm-hmm.
He talks
Mm-hmm.
about and he shares what he eats. We have no
Mm-hmm.
excuse, guys. we need to do this because, like Dr. Yvonne was saying, nowadays people are not eating fresh produce, Yvonne. That's the sad part. And hence you're saying starting to see cancer in the 40s. And the obesity in the world.
Yeah.
The obesity. Do you want to share? Please, I want people to have hope about obesity. What is out there? Do we have medication? Because now we know that obesity is a disease like other illnesses. Yes, give people hope
there is
here.
Hope. There is hope. Like in Canada, there are at least 3 medications that are recommended for obesity, you know, and in the US, there are about 5 of them. So I'm sure as time goes on, it will spread to the rest of the world. And just a reminder that obesity, it has to do with hormones also. It's time to put an end to the eat less and move more movement. In the past, they used to see people with obesity and say, oh, it's because you're lazy, it's because you're gluten. I've had patients who've come to me to say they went to a clinic and they told them, oh, if only you could stop eating that cake, you won't gain this much weight. And I go, hold on. Obesity is not only about what you eat or if you're less active. It also has to do with hormones. There are so many different hormones. You know, there's the ghrelin, which is the most common one that makes you want to eat. And there's the leptin that, you know, that tells the brain that to stop eating. And there's insulin, which is like the fat storing hormone. You know, so there's just so many things into play. And for people with obesity, this is dysregulated. And when it's dysregulated, there are different things that we can do. Is you can do cognitive behavioral therapy to help. But since we all know obesity is not real power, that's when they came up with those medications, you know, and there's amazing results from that with weight loss. Amazing results.
I love what you just mentioned about mindset because us too, clinicians, we need to shift the mentality. I've had patients coming to me telling me that I avoided coming to see a doctor because the doctor I last saw told me I was fat. And I think he thinks, how do you say this? How do you put it across? You could be saying the same thing. I would like you to honestly share with us because there's also other colleagues watching us. Can you share with us the wording? Because we are also injuring our patients emotionally. People who are obese, they are already struggling with self-esteem, some of them. They are struggling with the image, the body images. You know, people are judging them. And when they come to us, they're already vulnerable. Can you please share on that? Because I would love us to change the language around this discussion.
Yeah, no, we have to change the language around that. We have to put an end to the stigma and the bias, right? We all know, you know, people with obesity, they're stigmatized, you know, they are not treated equally. You know, I've told you incidents of a patient that I had who nobody wanted to do a practice on her, and she ended up having cervical cancer, you know, and she herself, she had the self-esteem issues because she felt judged everywhere that she went to, then thereby avoiding coming to doctors. You know, there are times that somebody comes, let's say they come for their blood pressure medication, for example, and on their way out, maybe the doctor might just look at them and say, oh, you've gained weight, you know, you've gained weight, you know, do you know this can affect your health? Yes. And then the patients usually are like, I know.
Language.
Exactly. You know, it's kind of, you know, there are like 5 stages to ask. You have to ask their permission before discussing, right? You have to ask, you know, and say, okay, I know you're here today, for example, for your blood pressure medication, or I know you're here for your physical exam. Then on reviewing everything, I see that your body mass index, your BMI is in the obesity range. Do you think this is a good time for us to talk about your weight? Let them say yes. They have their body. They know how they are feeling, right? With the extra weight, they know everything going on. So the fact that you're a doctor doesn't mean you should just go ahead and start talking to them. And to them, it's like, la, 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 you're singing to the choir. You know, ask their permission. And if they tell you that, okay, I'm not ready now, you say, okay, when you be ready, I'll be ready. Just know that I'm here for you. Just know that I'm here to support you. And just know that whatever it is, you can't struggle alone. You know, because there's help out there. So, you know, when you let somebody, if you talk to somebody like that, they're going to be like, okay, sure, doc. Why don't I book an appointment?
And also the empathy your
Very
tone,
important.
your choice
Very
of words.
important.
Honestly, we need to change
Mm-hmm.
our narrative as
Mm-hmm.
physicians and nurses, nurse practitioners out there. I love that. I
Yeah.
love that, Yvonne.
Yeah.
Let's talk about, we cannot close here without talking
Mm-hmm.
about mental health. Now
Oh
we are in
boy.
the pandemic. We need to screen mental health for mental health because there's depression,
Very important.
or there's alcohol abuse, there's other
Very
drugs,
important.
illicit
Yes.
drugs.
Very, very important. Very important.
Right.
You know, I've made it a habit now. My patients who are struggling with mental health, you know, that have pre-existing condition, I try maybe even once or 2 weeks to just check on them.
That's what
And
I'm
it
doing.
makes
Yes.
such a big
They
difference,
appreciate it.
you
They
know? And
appreciate it.
it's so
Yes.
important. And for
Yes.
those, even those who don't have, that
Yes.
simple, sincerely, how are you doing?
How
And
are
then you
you?
stop. You
Yes.
stop and you make that face contact with them and watch their response. Most of the time they will go, I'm okay. And I go, that's not convincing. Let's
Yes.
talk, you
Let's
know?
talk.
And you'll be
Yes.
amazed at what comes out when you just take that extra
Because
moment to
you
just
saw
say,
them
hey,
cared.
yes,
Yes.
yes.
Yes. I love it, Dr. Yvonne. Do you want to share what
Mm-hmm,
symptoms people should look for with
mm-hmm.
all of what's happening here in the world, depression symptoms, so that people can quickly go see Dr. Yvonne, Dr. Unati, and
Mm-hmm.
their physicians? Yes. Do you want to give us, a
Yeah,
breakdown before and the duration, please?
I know for some people it's either they can sleep or they sleep too much. Some is they just lost interest in all the activities, you
Yes.
know, energy goes down, you know, some people just feel guilty with whatever is happening around them, or if there's anything they feel that they are at fault because of that. Concentration, appetite either up or down, you know, and hedonia, they just don't enjoy what they are doing. And for depression, this will go on for about 2 weeks or so, you know. So if it's not up to that, if there are some that maybe it's just all the changes that's going on, that their mood is just a little bit low. So you have to make a difference with that. But when it's going on past that period, hey, when somebody tells you, you know, so it's somebody who used to call you and suddenly you call to talk to them, you're like, I'm tired. Oh boy, you really have to think twice.
Yeah.
You really have to
Yeah.
think
Thank you
twice,
so much.
you
Yes.
know?
And these symptoms are occurring for 2 weeks or longer. Please go
Yes,
see your doctor. Yes.
yes,
And
go.
I want us to talk about men's health, specifically depression,
Hmm.
because they present slightly different. This is my favorite topic. Men here, I want to actually emphasize this to the men watching us.
Mm-hmm.
Men present slightly different
Mm-hmm.
compared to the counterparts. When people with men have depression, they tend to be angry,
Very.
and can come
Yes.
with aggression,
Mm-hmm.
violence, with the
Yes.
gender-based violence that is happening
Yes.
out in the world right now.
Mm-hmm.
You need to look deep down in your heart, what is going on with me? Men
Mm-hmm.
tend to present slightly different, and you need to unpack their story because a lot of times they come with
Yes.
headaches, they come with
Ah,
back pain,
yes. Yes.
stomach upset, all
Sleep.
that. We
Yes.
need to
Mm-hmm.
unpack their stories. And
Mm-hmm.
sometimes I find, Dr. Yvonne, they coming with those symptoms. And when you unpack, I usually come and
Mm-hmm.
talk about difficult conversations. How are things at home? How is your
Yes.
sexual life?
Oh, I
That's
was about
the
telling you
reason
that
they're coming.
erectile
And that's the
dysfunction.
main reason they
Very.
have
Yes.
depression,
Yes. Mm-hmm.
because they feel the sense of loss.
Yes.
They feel there's a sense of loss in their manhood.
Mm-hmm.
So we need to start these conversations with our patients, because a lot
Very,
of
very.
times
Yeah.
the cause of depression could be
Mm-hmm.
that.
Yes. I
Yes.
think, we healthcare professionals, we need to be more empathetic now
Yes.
than ever before. you know, t-
Yes.
and while doing that, also take care of ourselves, self-care,
Yes.
because we can get burnt out with everything going on. Our patients are
Don't you see
depressed.
how I decided to quit Fridays? I had to, Yvonne, because
Mm-hmm.
I'm consumed in my work. So I'm glad you're mentioning that. We have to
It's so
take
important because you can
care of
pour out of an empty cup. If we don't take care of ourselves, how can we take care of our patients, right?
yes.
When someone
Yes.
comes to me, I want to be able to give them my best. But if I'm not my best, they're going to
I know.
feel that negative energy. They're going to feel that,
Of
they would
course.
feel it. you know.
Yes.
And to me, it's just filling my own cup. If I fill my cup by taking that time for myself, maybe 30 minutes in the morning, at least, or an hour,
And your
meditating,
affirmations, of
exercise,
course.
do my
Your
affirmations,
affirmations,
do my
of course.
prayers.
We're gonna end our discussion with the affirmations, by the way. I love them. And of course, you know what, Dr. Yvonne, it breaks my heart when I see colleagues dying of cancer and stuff like that, and
Mhm.
ischemic heart diseases, and you find that they were pouring themselves to the
Yeah.
work we do, and they never went for screening. So it's important for us to also look
Yes.
after ourselves and screen and screen and screen, because
Hmm.
some people, they think they're immune to these things. We also human.
We're human.
Doctors die of cancer. Doctors die of
Yeah.
heart attacks.
Yeah.
Recently, Dr. Yvonne, did you hear about the suicide in the States? Recently, I think beginning of
It's
this
like
week.
this. Yeah. It's terrible. It
So
is
doctors
terrible.
are also vulnerable.
Yeah. Yeah.
They get
You
it.
know me. I always talk about vacation. You know,
Of
I'm
course.
gonna, if I feel like, if things are, I feel overwhelming, I'm gonna take that time and just recharge,
I
right?
know.
If I'm
The,
sad about
the
something,
guy said,
I'll cry away.
talk about that. I love it. By the way, to our viewers, Yvonne and I, we have moments of our times where we say, this is a cry session, this one. Of course, we need to do that, Yvonne. Yes, we need to. Human. I love it. And you know what, Yvonne, before we close, we can't close without discussing seniors' health.
Oh
The
boy,
use
yes.
of alcohol, they are struggling with loneliness. I have my
Yes.
patients that are struggling, Yvonne, right now with
Mm-hmm.
alcohol, excessive alcohol.
Yes.
And if you don't get the collateral information from their relative, you will not get it from them.
No,
And
no.
unfortunately, we need viewers here, keep an eye on your parents, because they
Yes.
are lonely. Things
Mm-hmm.
have closed down. They are unable to meet with each other.
Mm-hmm.
So there's excessive drinking, and they
Yeah.
are falling. Some of
Yes.
them are taking
Yes.
medications like blood thinners, like warfarin. When you
Mm-hmm.
are when you drink alcohol,
It,
warfarin
it
gets more
affects it.
thin.
Yeah.
It makes blood more thin, and when
Yeah.
they fall, when they
They bleed.
unfortunately get drunk, they get
Mm-hmm.
brain bleeds.
Yes. Yes.
Seeing that in the strokes that are
Yeah.
coming with
Mm-hmm.
this, yeah, I wanted
Mm.
to remember that. We're starting to
Yeah,
see
no,
that
it's so important.
trend that is
Loneliness, it's such a big thing for them right now,
right
right? I
now.
just have my list where we just check on them. How are you doing? And sometimes it can go for 10 minutes talking about everything. They just need
Yes,
somebody to talk to, you know?
yes,
So if you're out there and you have someone, even in the community, like if you have some seniors number, just make it a habit to call them once a week, once every
yes.
other week, and just talk to them. If you have some time, cook them some meals and drop by the door. Show
I
them
love
some love,
it.
show them some love. It's so, so important.
They
So,
appreciate.
so they
They
do.
appreciate.
They
When
do.
I do excision of moles in the clinic,
Mm-hmm.
I love talking about their childhood. I
Mm-hmm.
just love my seniors. I want to hear about their childhood stories.
Yes.
How
Yes.
was it for you?
Mm-hmm.
Who
Mm-hmm.
are you in love with? Do you
That's my favorite story too.
want, who okay, and then how many years you've been married? And yeah, they start sharing all these things, and they
I like
feel
the
good
story
about
of
it.
their first kiss. That's always
Oh yeah,
exciting me.
the best. And then they like, oh, why am I sharing all of this stuff? And I just love it when we can be human with our patients. It's
Yes,
so beautiful. We connect, it's so
it
beautiful when,
is. It
heart
is.
to heart
It is.
discuss. I love
Mm-hmm.
it. And sometimes there's one that really loves coming to our clinic. Every week she says, I want to check my blood pressure. I let her. She lives alone. She lives
Yes,
alone.
exactly.
Right? So
Exactly.
I always give it an appointment close to lunchtime, and then we can
Mm-hmm.
visit afterwards, right?
Yes.
Because I don't have
Yes.
anyone eating. So I think it goes a
Mm-hmm.
long way. It means a lot to them.
Mm-hmm.
It
Mm-hmm.
means a lot.
And
And of
yeah.
course, oh my gosh, Dr. Yvonne, we have to close. I want us to
And our
talk about,
children. Let's not forget our children. Let's take care of
yes,
them too. Let's take
yes,
care of them. Very, very important. They are struggling too, and they don't know how, some of them don't know how to express themselves. Very, very important. Let's create time with them. Yes.
let's create time, parents, with our kids, and also watch what they are watching on the
Yes.
internet, because they're
Yes.
spending more time on the internet.
Mm-hmm.
The drugs that Yvonne, I have as young as a 12-year-old in my practice that I'm dealing with a drug problem. So honestly, they are helpless, they are frustrated, they can't see their friends. So parents need to be involved and watch an abnormal behavior. Your child, if he or she has changed, sit down and have spend more time and ask and seek the help you need. The hospitals are open 24/7.
Yeah.
Hospitals are open 24/7. I want to have this session again with you. I just loved it. Dr. Yvonne, before we close, by the way, Dr. Yvonne, I forgot to mention that Dr. Yvonne is the CEO of Breakers Health. Check it out online. She's doing amazing work. I don't want to share what's coming for her. She has a big project coming. I can't wait for that project to come to pass. Yvonne, I'm so excited for the people living with
I know.
I'm excited that the government is on board and supportive. I love that because we need the government and the policies to change. Kudos to you. Congratulations, sis. So Dr. Yvonne is the CEO of Breakers Health. Check her out. Walk with her. She'll walk with you. The one thing I like about her approach, she's not forceful. She's helping you in your journey. She journeys with you. Got amazing results in her practice and outside. So if you need private consultation with her, she's available on LinkedIn. She's available on Instagram, on Facebook as her name here, Dr. Yvonne Concord, or you can Google her website, Breakers Health. Dr. Yvonne, before we close, do you want to please share your affirmations and another word for our viewers here? Thank you.
Oh boy, you take care of yourself. Remember, you are enough. You are beautiful, you are handsome, and don't let anybody else tell you otherwise. Remember that. Wake up in the morning and say that to yourself every day. And remember, it's gonna be a good day. Don't you forget that.
I love it. I love it. Yeah. I love it, Dr. Yvonne. Thank you so much. We'll do this again. And to our viewers, thank you so much for staying with us. We meet same time here, same place next week. God bless. Thank you so much, Dr. Yvonne.
You're welcome, Dr. Nachi. And just to let the viewers know,